Well, I certainly want to welcome all of you tonight to a special program of Discover Immunotec. Uh, my name is James Spencer. I've been asked to be your invited speaker tonight, and we have a special program that's going to not only tell you a little bit about the company and about the product, but a little bit of the history of the company, which many of you perhaps have never heard before. Now, tonight we're not going to have any question and answer, but at the end. But what you can do is you can type in comments along the way, and someone will probably help answer some of those points that you raise. And then at the end, of course, you will be able to have a very nice overview of our company, where it came from, and where it's going. So I'm going to go ahead and get us started tonight. And I'll share the screen. Very good. All right. So in case you're wondering who I am, my name is James Spencer. I'm a platinum consultant with the company. I've been a platinum for many years. And I've been working with the company for more than 26 years. So I've had the opportunity to see the company grow from very small beginnings to a very large company. And really, the sky is the limit for this company. We have great expectations of how large and widespread our company will get. And that's because we have such a great product line and a great message. And of course, we also have a disclaimer. The disclaimer is usually mentioned because we talk about natural modalities. The statements have not been evaluated by the Food and Drug Administration. The product is not intended to diagnose, treat, cure, or prevent any disease. The presentation is not designed to provide diagnosis, treatment, or medical advice. Product, services, information, and other content provided in this presentation, including information that may be provided in this presentation directly or by linking to third-party websites, are provided for informational purposes only. Please consult with a physician or other healthcare professionals regarding any medical or health-related diagnosis or treatment options. And one other point with regards to income disclaimer, the result and income examples that might be shown in the content are meant simply as an illustration. They're designed to give you an idea of what's possible. Individual results may vary, and Immunotec does not guarantee that anyone will make any specific amount of money. Success in any business requires leadership, skills, commitment, and dedication, and will be dependent on your effort. Now, Immunotec's independent distributor system is designed to convey truthful, timely, and comprehensive information regarding the income that an Immunotec independent consultant might potentially earn. And you can find that IDS in the legal tab on immunotec.com. Now, that being said, we're going to talk to you tonight about an amazing scientific breakthrough. And what you see in this, in the forefront here, is the chemical design for a molecule called glutathione. Now, glutathione was discovered many years ago, way back in 1888. And although they didn't have all of the information at that time, over the last century, they've been able to confirm that it's a substance that's very important. It exists in every cell of your body, and it's considered one of your most powerful protectors. Now, the first gentleman that discovered it was a Frenchman, J. de Repahati, and he was doing some extracts of yeast and animal tissues. But at the time, he thought that it was composed of 2 amino acids. In fact, he called it a dipeptide and thought it consisted of cysteine and glutamate. And he called it phylothione, which means, by the way, love and sulfur in Greek. About 41 years later, a scientist named Hopkins realized and discovered that there was 3 amino acids, cysteine, glutamate, and glycine. And so that's when it became became known as glutathione. Now, it was another 60 years later before someone figured out how to implement and make use of this discovery. I liken it to the Indians in the United States discovering oil, but they didn't know what to do with it. It was generations later before they realized that it could do so many different things. Now, it's a fascinating story for you to learn tonight as to how this discovery was implemented into the modern benefit that we know of today. And I'm going to tell you a little bit about the gentleman that did this. His name was Gustavo Bounous. Now, Bounous was raised he was born in 1928, and he was raised in Italy. His mother was a very positive thinker. He grew up during World War II, and his mother realized that there was a great need for doctors. So she constantly told him, "You need to become a doctor." And well, you know what they say, you got to listen to mama. He decided to apply for the medical position at the University of Turin in Italy. It was a medical doctor program, and he was accepted in 1948. Now, interestingly, one of the guest speakers that came in 1948 and spoke at the University of Turin was Dr. Alexander Fleming. And Bounous was to be greatly impacted by his seminar. In case you don't remember, Dr. Alexander Fleming discovered penicillin. But he pointed out in his seminar that it was a complete accident that he discovered penicillin. And he went into great detail about how he left his laboratory and didn't wash certain plates. And when he came back, he found the bacteria was being pushed back by what he eventually called penicillin. So he thought to himself, wow, a great discovery like penicillin could be a total accident. Well, he graduated in 1952 as a doctor of medicine, but he had to go to Genova to do a 4-year residency in surgery. And this is where he ran into some complications with his mother. His mother developed cancer, and his mother, Ada, had a terrible time with ovarian cancer. He heard her physician tell him that there's nothing they could do for her, and she died in agony. And that experience probably is one thing that drove him years later to try to find something that could help cancer patients. Well, in 1956, he was able to get an invitation to come to the United States. At first, it was to deliver some data, but he wound up staying at the Indiana University Medical Center, and for the next several years distinguished himself as a medical researcher. Now, unfortunately, the United States did not recognize him as a doctor, and so by 1960, they were going to deport him and send him back to Italy. But the overseer of this department wrote a letter to McGill University in Montreal and recommended that they consider accepting him as a medical researcher. And sure enough, they did. And so it was that in 1960, he came to McGill University in Montreal. And for the next 5 years, he distinguished himself as a medical researcher. Now, just to give you an idea of how much impact he had, in 1965, he was awarded the Medal of the Royal College of Physicians and Surgeons of Canada. And this was primarily due to his work on hemorrhagic shock. Within 3 years, he was made a career investigator of the Medical Research Council and a lifetime member of the Research Council. Now, what was so amazing is that the Medal of the Royal College of Physicians had never been given to anyone that was not a Canadian. And he was Italian. So it really was amazing that he received these honors. Now, this made him start to work in the field of nutrition. And that was quite advanced. If you go back and try to find any kind of research on nutrition, you'll be very hard pressed to find it. But during the years of 1972, he worked on a diet that could be given to people that were in comas, that had to be tube fed. And it was called the Elemental Diet. And it was such a successful program that really it's used worldwide. Almost every hospital on the planet uses the Elemental Diet to keep people alive that are in comas or in long-term needing that type of feeding. So this got him recognition as a pioneer in nutrition. And by 1978, his pet project was to study proteins. And I have to tell you, that really had an impact on him, because his mother, as a late-stage cancer patient, really couldn't absorb protein. And of course, her body stripped the muscle from her bone. And that's what happens with late-stage cancer patients. They're not able to absorb protein very easily. So he wanted to find a protein so easy to absorb that could help anybody survive even longer, even if they were fighting cancer. Well, he filled out the paperwork, he got approved, and he got funded by the Canadian government, and he got a grant. So he started feeding groups of mice proteins from all over the world. He had many, many groups, dozens of groups of mice eating these different proteins. Well, we may never have heard anything more about Dr. Bounous, except a mysterious box arrived after he was well into this research. And when he opened it, it had a protein that came from a company in Switzerland. They asked if he could research this protein and tell them if it had any commercial value, because it was a byproduct of their industry. They were dumping it. They didn't know what to do with it. Well, they enclosed a $10,000 check in that box and said, please use this to help with your research expenses. So what would you do? He started feeding another group of mice. And lo and behold, within a short period of time, he saw a phenomenal response. The mice were more energetic. They weren't getting sick like some of the other control groups. And after a year and a half, 2 years, he realized they didn't die like the other groups. They just kept living and living. And not by a little bit. We're talking 30, 40, 50% longer. Now, this got him very excited. But actually, it would get anybody excited. If you found out you had a protein that if you ate it every day, you could live 30 or 40 or 50% longer, what would you be thinking? I know what you'd be thinking. How can I get my hands on this protein? Well, during this time period, he wanted to have very concrete evidence of what this protein was doing. So he asked Dr. Patricia Kongshavn, who was also working at McGill, to help him to document this research. Now, Patricia, give you a little background on her. She was the first PhD of immunology in all of Canada, a brilliant woman. And so they made a dynamic duo. As time went by, she was able to document not only what these mice were experiencing, but how their immune function worked. Now, up to this point, Dr. Bounous wasn't quite sure of what the mechanism was that was producing all these amazing events and amazing benefits in these mice. And one day, he had a coffee break with Gerald Batiste. Now, of course, Gerald was a lot younger than this picture shows him. He's quite a prestigious researcher himself to this day. But over a coffee break, Dr. Bounous said, I'm seeing amazing things with this protein. The mice, I tried to inject them with a chemical that would give them cancer, and lo and behold, I couldn't even give them cancer. All the other groups got cancer, but these mice and in this case, he used a chemical called dimethylhydrazine. These mice, I couldn't even get them to start developing tumors. And if they did get any tumors, they were little tiny, and it didn't impact their health. Well, Dr. Batiste, then known as his medical student, Gerald, said, you know, I wonder if there's something in this protein that's raising glutathione. Bounous said, glutathione, I never thought of that. Let's research it. So they used a spectrometer and they tested the different mice, and sure enough, all these mice had almost no levels of glutathione that were getting that chemical. But the mice that were on this powder, this protein powder, had very high levels of glutathione. So it was a serendipitous, accidental discovery over a chance coffee break. And let me let you hear how Dr. Bounous described it. Actually, let me enhance the video for a second, because you may not be able to hear it well. Okay, let's go back.
When I began my research study on the effect of whey protein concentrate in mice, that's the animal we were using for, I did not expect to stumble on the role of glutathione. What we did, in fact, we observed accidentally that mice eating this type of protein were able to mount a stronger immune response when challenged with bacteria, antigen, or cancer. But then later on we observed that these animals, in fact, were able to synthesize glutathione more effectively than the control animal. And then, of course, we had to find out what was the role of glutathione, and that we took advantage of the enormous and abundant data from the medical literature on the function of glutathione.
Now, I filmed, I made that film of Dr. Bounous more than a quarter of a century ago. I wanted to get his thoughts on it, and sure enough, he said, you know, this was a total accident. But he was like Alexander Fleming. He was smart enough to recognize it was a discovery. And so he really poured his heart and soul into the research that ensued. So let's go back to our presentation, and let's see some more information. So he began to publish papers on what he was discovering. And one of the requirements of the Canadian government when you get a grant is that you have to publish your findings in peer-reviewed journals. And so one of the early studies that he published was this one, The Influence of Dietary Whey Protein on Tissue Glutathione and the Diseases of Aging. And it was here that he reported that the mice were living between 30 and 50% longer. So this started to get the attention of scientists. He also then, with the help of Dr. Kongshavn, was able to explain the immuno-enhancing property of this dietary whey protein, and that it was the role of glutathione that was doing this. So this was groundbreaking information. He also named this protein, he called it Immunocal, and obviously had proven that it raises glutathione. Now, he got the name, from the fact that it benefits the immune system and it has a small amount of calories. In fact, there was only about 40 calories to a dose of 10 grams. So that's how the name Immunocal was thought up. Now, during the 1980s, he, along with thousands of scientists, were trying to find something that could help this new epidemic that was exploding all over the world. What was it? Well, it was HIV and AIDS. So Bounous thought, I wonder if this could help someone with HIV infection. Sure enough, he got approval to start doing some human studies, and it led to a discovery that, yes, it helped HIV seropositive individuals. So this study was produced, whey proteins as a food supplement in HIV seropositive individuals. And this was published in the Clinical Investigative Medicine Journal. Now, this got the attention internationally. because so many people were trying to find something for HIV, including this doctor over in France, Dr. Luc Montagnier. And he was so impressed with Dr. Bounous' discovery of Immunocal and what it could do for HIV that in his book on oxidative stress and cancer, AIDS, and neurodegenerative diseases, he put an entire chapter, chapter 42, in his book just on Immunocal. Now, that doctor discovered the HIV virus and won the Nobel Prize for Medicine. So you can be sure that many other people started to take note of Dr. Bounous' research, and it led to many, many more studies involving Immunocal. Well, that might have been also the end of the story. Dr. Bounous was forced into retirement by the Canadian government. You have to retire at a certain age, but he just couldn't bring himself to stop this research. He thought, well, maybe I can use my life savings. I'll study it on my own and continue the research. Well, in trying to find a location where he could set up a lab, he bumped into Dieter Beer. Now, Dieter had come to Canada to retire, but he had purchased a number of real estate buildings, and it just so happened that Bounous wandered into one of his buildings. And as he met Dieter Beer and he explained what his research was involved with, Dieter took an avid interest in it. In fact, I'll tell you a quick story. Dieter was amazed when he told him about all of this research. And he said, do you think this could help my mother? My mother, she's got a serious illness. It's inoperable. And Dr. Bounous says, yes, of course it will help. Well, long story short, his mother at the time was 74 years of age and had a serious challenge. But they put her on the Immunocal, and long story short, she lived to be 94. And of course, this is so impacted Dieter. He said, listen, don't worry about the cost. I'll help you with the finances. I think everybody needs this product. So much to his credit, Dieter put his resources now behind Dr. Bounous. Well, after 8 years of working together, they were able to receive 5 pharmaceutical patents. And again, that might have been the end of the story, because Dieter had tried to go to a number of companies, even drug companies, with these drug patents, and they were all saying different things. Well, it's too expensive. It costs a lot of money to make it. We like to make things for pennies that we sell for dollars. Well, someone introduced Dieter and Dr. Bounous. In fact, it was Dieter's attorney. Alex Konigsberg. He says, you know what? I'm going to introduce you to a man that can help you with this remarkable product, and that's Chuck Roberts. So in 1996, Dieter met Chuck Roberts. Chuck had a distribution company called Evergreen, and Chuck was so impressed with what Dr. Bounous and Dieter Beer told him about all of these years of research. By that time, it was like 18 years of research, that he said, I'd be willing to just drop all the products I'm distributing and just work on distributing this amazing product. Well, that's all Dieter had to hear. He says, you know what? Let's be partners. So they started a company called Immunotec Research Ltd, and the rest is kind of history. Now, I still had not heard of them yet, but the following year, Dr. Jimmy Gutman found out about Immunotec, and he found out about the amazing new product, Immunocal. And Dr. Gutman was so fascinated with it that he started researching glutathione, and today, he's the most widely published author on the subject of glutathione in the world. And he's become the chief science officer at Immunotec. So we've been very happy to have, for the last 27 years, a tremendous talent like Dr. Gutman to help us continually refine and prove more and more frequently the benefits of Immunocal and just how good of a product it is. Around the year 2000, Dr. Wulf Dröge made himself, or I should say he should introduce himself to Dr. Bounous, first by telephone and email. And he had been very closely following the research that Dr. Bounous had been doing. And he had been researching glutathione in the Heidelberg Institute over in Germany. But he was using a drug called N-acetylcysteine, NAC. And when he found Bounous had a natural product that did it even better, wow, he was all over it. I'll give you some background on Dr. Dröge. At this time in history, he was probably considered the preeminent immunologist in the world. He had worked at the University of Freiburg, the Max Planck Institute, the Harvard University, the Basel Institute. He was the department head of immunochemistry at Heidelberg. He had been published over 300 times. Now that's, I've never met anyone with that many published articles, frankly. And in the field of redox, he was so far advanced in the field of redox that when he would publish a new article on redox status in the human cell, he had to quote himself because there was nobody else to quote. So he came over and joined forces with Dr. Bounous, and this led to the development of the Immunocal Platinum. Well, flash forward to 2017. By this time, Dieter and Chuck Roberts had gotten very old. They were ready to retire, and they turned over the reins to this young man, Mauricio Domenzijn. And Mauricio has now taken the leadership of the company from just a handful of countries, 3 or 4, to now about 18 different countries. And the expansion is dramatic, and the growth is dramatic. So we look forward to all of the future plans that he has for the company. So just to recap, 1996, Immunocal was released to the general public. It was 2004 when Immunocal Platinum came along. And then finally in 2022, the Immunocal Sport. Now, all 3 of them have the same amount of Immunocal, but there's additional ingredients and formulas in these to make each one of them a very unique product. What's the main thing Immunocal does? Well, it simply optimizes glutathione. And if you look in the physician's desk reference, or the PDR, it'll tell you right there that's it's a U.S. patented natural food protein isolate in the FDA category of GRAS, generally recognized as safe. It assists the body in maintaining optimal concentrations of glutathione by supplying the precursors required, here it is, intracellular glutathione. So this is an amazing product, and what it can do allows glutathione to protect us on a daily basis from the carcinogens in our food, heavy metals like mercury and lead and cadmium, the toxins from car exhaust, secondhand cigarette smoke, radiation like ultraviolet, X-rays, alpha, beta, gamma. What an amazing substance in our bodies. Now, there's more than 185,000 published medical and scientific papers on glutathione, and this validates all of this research. So if you want to remember the 4 basic things it does, remember IDEA. The I stands for your immune system is benefited. The D stands for detoxification of harmful things. The E stands for more energy in your body. And the A stands for antioxidant protection against oxidative stress and free radicals. So basically, when you introduce Immunocal into your body, it has the critical amino acids that lets every cell in your body make glutathione. It's like nature's fountain of youth. And quite frankly, it's backed up by years of science. We now have, I think we've got 79 patents now, but there's over 80 published research studies, 50 different medical journals with over 200 different authors. It's been approved for all sports legally worldwide, and we even have a kosher version. And with this kind of a protein, you can be sure that it's getting a lot of scrutiny by some world-class athletes. So you can bet your bottom dollar that if these athletes that you see here all want Immunocal, what can it do for you? So it's been my privilege to explain these things to you tonight. And you have a greater advantage than I did. When I got introduced to the company, they only had one product. Now there's more than 20 products, and they're all products that will help and benefit you. Now, as it has been the case for all of these 26 years that I've been with them, you can't get it at stores. You can only get it through an independent consultant. And that's what's kept our business growing, growing, growing. The consultants can get customers, and they can get other distributors, and they can become financially independent. We took the founder's decision of going with direct sales, and that's why you don't see it in retail stores or on television or in magazines. It's one-on-one. We tell people about it, they fall in love with it, and then they share it with other people. So that'll conclude our program. We invite you to join us on our mission to acquaint the whole world with Dr. Bounous and Dr. Kongshavn's life-changing discovery. So thank you very much for being with us tonight. If you have any questions, get together with the person that invited you on, and tune in for more of these special programs, which will give you insight into Immunotec's amazing products.